Hello, I'm Dr. Bogdan. I wanted to spend a few minutes talking to you about neck rejuvenation. One of the earliest signs of neck aging is fat excess on the neck, which can soften the neck contours or create a double chin. As we get a little bit older, skin excess starts showing up, and especially on thinner necks, vertical muscle bands can show up due to years of muscle use. Finally, because of neck flexion, horizontal skin creases can develop as well, and all of these are advanced signs of aging. Surgically, these can all be addressed. Excess fat in a young neck can be removed by liposuction, and when the skin elasticity is not so good, direct excision can be performed during a facelift procedure or neck lift procedure. The excess skin requires skin removal, which can be performed during a face or neck lift, and the vertical muscle bands require muscle surgery to address them. The horizontal skin creases are softened by the skin elevation component of a facelift, and I'll show this to you a little bit later. To go through a couple case examples, I'll show these points. First, this is a very young patient who has good skin elasticity, but she has a little bit extra fat on her neck itself. We address this by doing liposuction, using small incisions in front of the chin and behind the ear. And then the neck is contoured by removing the fat from below the skin surface. Here you can see the results of the surgery, as well as the before and after picture. You can see the neck contour is improved by the fat removal. Another example of fat excess is this gentleman who's a little bit older, so his skin elasticity is not quite as good. The fat you can see here that's softening his neckline, and the excess skin will need to be removed around the ear. To do this, facelift incisions are drawn as shown, and the excess skin is moved in the direction of the incisions. This creates contour as seen here, and you can see that the fat removal and skin removal sharpens his jawline significantly, which youthens his face. In a patient who has a thin neck, signs of aging typically show the muscle bands. Taking a look at her neck, you can see these vertical lines that make the neck appear older. We address this by making incisions in front of the ears and then under the chin. And from this you can lift up the neck skin and see what's below the surface. The vertical bands we saw a moment ago are really the edges of the platysma muscle. To improve her neck, we need to bring the muscle edges together so that you don't see an edge. This is performed by lifting up the edges of the muscle and then stretching them towards the midline. Once together, the muscles are sewn together, and this creates a corset across the neck, which improves her neck contour as seen here in the before and after pictures. You can see that the vertical bands make a significant difference in the aging appearance of the neck, and the lack of the bands really smooths the neck contour out. Skin removal was performed as well. In this next patient, you can see that there are the same type of vertical muscle bands on the neck, but you can also see some horizontal skin creases caused by years of neck flexion. Additionally, he's very thin and has very little fat under the skin surface, so you can see the outline of his Adam's apple and neck cartilages through the skin. So all of these things make the neck appear older. To address them, first we make incisions in front of the ears and then under the neck, which allows us to lift the neck skin up and again see the muscles below the surface. The borders of the muscles are what's creating the vertical bands, and you can see the outline of his neck cartilage through the skin as shown here. To get rid of the vertical bands, we want to bring them together in the midline, and this is done by undermining the muscles and then stretching them towards the midline. This process also adds a little bit more padding in front of the neck cartilages, which will serve to soften these as well. Muscles are sewn together, and then we still have the band on his right hand side, which we need to stretch out to finish the neck contouring. You lift the edge of the muscle up and then stretch it out to smooth out his neck contour. And you see that this does a significant job of getting rid of the bands, softening the horizontal skin creases, and also adding some padding in front of his cartilage to really soften the neck and make it look more youthful. A patient example that shows obvious skin excess is this nice woman. She lost a significant amount of weight, and the deflation of her skin shows up as skin excess and advanced aging. She also has the vertical bands created by the muscle edges. And you can see that there's skin excess that sometimes is referred to as a turkey gobbler. Again, skin incisions in front of the ears and below the chin are made. The skin is elevated off. And then we can see the muscles again. The edges are, as we predicted from what we could see on the outside. We want to bring these together. That's done by lifting the edges of the muscles up and then stretching them towards the midline. They're then sewn together, and the neck contour changes as you see here. The skin removal was similar to what I showed in the second patient, and the scars are hidden around her ears. I hope this was educational. If you have more questions, please visit the website